Welcome. Come with me. The doctors will see you now.
Welcome back to another episode of Fast Talks with Family Docs. I'm Dr. Phil Palmer.
And I'm Dr. Veer Vidala. Well, we're back with Dr. Smallwood. Dr. Smallwood, thank you for being here. This last episode, we talked about your very unique practice of doing unique immigration physicals and being a civil surgeon, and had learned a lot from that experience, your experience. It's not something that we typically hear about.
Yeah,
so thank you so much for sharing, especially the experience of the patients of yours and how you're helping them. But shifting gears here, you're also an ER doc, and you're also involved in mentorship. So I thought this episode we could talk about some of your other roles that you fill. Palmer, do you want to take on that first question?
Yeah, you bet. So you work in the emergency department for the Cherokee Nation.
I do.
And I'm sure you've had experience working in other realms. So, I know urban ERs can often be different paced and different patient population than a rural ER. What's your experience in the Cherokee Nation? Is that differ from other settings you've worked in?
It does, because as a family physician, I worked in a practice, worked hospital-based, and then worked for a private group. But all along began moonlighting, or all along have kind of continued moonlighting in the ER. I started moonlighting in the emergency room at Claremore Indian Hospital way back at the beginning of 2000s, 99, 2000, somewhere in there. And then eventually moved over to Tahlequah City Hospital and over to W.W. Hastings. And never really stopped with my privileges at Hastings Hospital, even though I may have taken like a year or two off or so. I never really stopped with my privileges there. So I think I started moonlighting, picking it back up again, 2006, 7, somewhere in there. Right. And in 2008, the tribe, Cherokee Nation tribe, compacted that hospital. It was an IHS hospital, so run by the Indian Health Service. And when they compacted, they came in with decent pay for the ER physicians. And at the time, their director was one of my good friends, Dr. Thomas Franklin, who I'm not sure if you know, but...
Yeah, was he in the Air Force?
Yes.
Yeah, I do know him from when I first joined the military. I had a chance to work with him.
We began moonlighting together at Claremore. Unfortunately, we miss him. He passed away last year.
I didn't know that.
Yeah.
I'm sorry.
But he was instrumental in getting me into Cherokee Nation. He was like, come on over. You know you like it. Do it. Yeah. So I actually left doing family medicine to go work in their emergency department. Now, I could say I left family medicine, but I really didn't, because in the emergency room and in our urgent care, it was like a family medicine practice, It is different because it's not only rural, but it is also tribal. So it's a little different in how that is set up, which I appreciate it being set up. We have what we call a closed system. We're payor and we're payee all at the same time. Yeah. So as you were talking a little bit ago about patients not being able to afford colonoscopies, I don't necessarily have to worry about that because we perform them at our hospital. Right. And so any tribal member of any tribe with a recognized tribe actually has access to be able to come to any of our facilities for treatments that we provide in-house. Yes. So it's wonderful.
That's definitely.
Just need to get them there.
Yeah. Now, I was already thinking to ask you a question, and you've referred to it already, but I'm still going to ask.
Do it.
It's been my experience that a lot of ERs are like an urgent care clinic or a family medicine primary care clinic. What percentage of the volume through your facility over the course of a year is actual traumas versus more things that any of our listeners might see in their family medicine clinic or urgent care?
I'm going to go, if you talk trauma, I'm going to go with probably less than 10%.
Okay.
Right now, we have this big initiative, which we've done over the last couple of years, looking at stroke and cardiac issues that come in. Okay. Right. That's going to be like a good majority of what comes in addition to some of the other minor illnesses that come through. Yes. We have a sort of a fast track, which we call an ER overflow, where sort of our lower acuity patients may go. And that's typically staffed by a couple of docs over there. Okay. And then our main ER where the trauma bay is, and some of that higher acuity stuff is done on the other side. Right. In general, though, I have watched it change over the years where people would come in because they had a cold at 3 in the morning.
Yes.
You know, they sneezed at 3 in the morning and then they would come in. We've done a lot of educating. We've done a lot of changing our service. And part of that was because they didn't have a primary care because we were understaffed on the side of our primary care.
Right. Okay.
We are now almost fully staffed on primary care.
Okay.
Thanks
So
to
a
the
lot more
residency
resources
program.
for them.
A lot more resources for the patients. So now when they come into the emergency room, we're looking at them going, you know what? You probably are sick. You really do need our help.
Yeah.
We are the second busiest. Cherokee Nation's ER is the second busiest in the state, right behind St. Francis.
Wow.
As far as volume goes.
Yeah. Outstanding.
I know.
Outstanding.
That's
It's a lot.
fascinating. And
It's
it's
a
nice
lot.
that you have like a funnel system from the residency to jump into primary care. That's
It's
really,
wonderful.
That's really cool.
It's really, really good. Those second-year residents, family medicine residents, they come in and they're able to moonlight.
Moonlight. Okay.
Yes,
Makes
they're able to
sense.
moonlight in the overflow. I get to work
Mm-hmm.
with them in the overflow. I actually used to be the rector of that department as well, so
yeah.
kind of help with setting up some of that for them and making sure that they could work. We had an urgent care, but we were having some issues having urgent care and ER in the same space, and we didn't need to do that, so we just have the ER overflow.
Okay.
And then across the street at our outpatient clinic, we have a same-day clinic
Okay.
where you can present to be seen and get your needs taken care of. So you can go there if you are out of your blood pressure medicine versus coming to the emergency
Yeah.
department.
Well, that's great.
Yeah.
Yeah.
Dr. Smallwood, I could ask you about your ER practice forever, but we are called Fast Talks, so we have
Okay.
to move on to the next subject. I've been hearing a lot about the Youth Medical Mentorship Program.
Good.
All over,
Good.
seeing on social media and hearing it from other docs. One of my mentors, Dr. Jabran Pasha, we talked about him before.
Yeah.
What is your, for all our listeners, I think more people need to know about it because I think it's a really, really cool initiative to get students at a young age interested in the medical field. Can you explain to our listeners what that program actually is?
Okay, so I'm a member of the board of directors, right? And Dr. Chris McNeil, and I think I met him when he was a student.
Oh, wow.
And he was on fire then.
Yeah.
It's fantastic.
Yeah.
So I think when he looked at this, at the initiation of this program, it was, what are the students doing? What are our kindergarten, first grade, second grade students thinking about when they talk about, when someone says, I want to be a doctor? Do they really know what that means? Is that what they want, or do they just want to help in a medical way? Mm-hmm. They don't know because they may not know about the medical field, all of the options available in the medical field, right? So by the time you get to 7th and 8th grade, they know maybe what an EMT is, they know what a nurse is, they know what a doctor is, they know that there's a difference in those things, a pharmacy tech, a lab tech, but they might not have exposure to those.
Yeah.
That's what Wyman does, is it gives them exposure to different areas of the medical field in hopes of sort of promoting them into a successful career in medicine.
Wow.
Something in medicine.
So how do they give them that exposure? Do they spend weekends at a hospital visiting different departments? What's the system you guys have?
Oh, I
or the
thought you were going to
method?
list about 3 different other ways,
No,
because
no.
I was going to tell you, yes, they do all of those things.
Okay.
We have them volunteer at hospitals. We have volunteers, including medical students, residents, physicians, nurses, lab techs, pharmacists, all of the above, that will actually meet with groups or have groups come to them. So we might go to the school. The school may come to an office or come to a location where the mentors are, and they then will sit there and demonstrate or talk to them or have conversations about their field.
Okay.
I had an orthopedic surgeon meet with the students at Tahlequah High School, brought like some bone screws and samples and let them hammer and screw and those kids were just like, this is amazing.
Yeah.
This is amazing. I went to an event, the summit that they do, where they bring in all different types of specialties, and then all the students run in and get white coats.
Cool.
Yeah, it's really nice. And then they're assigned to different stations where we might do blood pressures here. We might come over here and do like a quick audiology exam. There may be some suturing material over here, and we teach them kind of how to even load and maybe throw a stitch, something like that. It's really wild just watching them and watching their awe and excitement about something that they thought about but hadn't really fully developed in their mind how it could be them. So by them seeing us And it's lots of us. I mean, it's all kinds of people. I'm impressed by the people that come.
Yeah.
And I go want to shake their hand.
Yeah.
By them seeing us, they're like, oh, yeah, I guess I can do that. Yes, you can. And then to help them matriculate into programs is fantastic.
So what age group are you targeting? Is it high school? Do you go to middle schools? What's the
We
audience?
target K through 12, but right now the programs are kind of focused on that seventh grade and up.
Okay.
And starting with them. And then we also provide support for medical students, for undergrad students who are interested in medicine, who might be like pre-med students, or they might be pre-vet students. And if they want to take part of the program, if they want to take part in the program, they can come join us as volunteers. They can come help. We are always looking for volunteers. We're in 12 counties now throughout with those programs and have some of the best mentors and directors on those programs.
So how long's YMS been around?
Let's see. It's YMM. I had to stop and think of what it was. Now, I'm trying to think fully. I know since 2023.
Okay.
But I cannot remember the initial date that he initiated. But I know 2023.
So within 5 years.
Yes.
Yeah.
It's a relatively young program at this point.
It is.
Yeah.
It is.
Who's the doctor that's the founder again?
Chris McNeil.
Dr. McNeil. Yeah,
Yes,
I was like reading about his vision and how much because he started it when he was he a medical student?
Yeah, he was a medical student. That's why I can't remember how long ago it was.
Yeah,
Because I feel like
Gotcha.
this is 23. This is his first year out of residency, or maybe he's about to start his second year.
Yeah.
So somewhere in there,
Okay.
It's
somewhere back there.
It's inspiring.
It
that
is.
His vision has come to life, and it's this big now. And there's like a specific focus on underserved of kids, right? And trying to get them in to a higher level of education and get them into the medical field and showing them the route and giving them opportunities, teaching them honestly. We say it as simply as, we're teaching them how to do blood pressures. That's a skill.
It is a skill.
It's just really cool because now they can use those skills and maybe become an MA or get that experience. And I think it's fascinating. How did you become a program director? Or how that? Yeah.
Because I am having a hard time finding the word no.
Okay. Got it.
Even though I do have it in my vocabulary.
Right.
So having met Chris and having, had that experience with him, when he started telling me about the program, I remember growing up in the 70s and 80s.
Yeah.
Having programs that I could go to that were STEM based. It was a math program. It was a science program.
right.
Oh, you could go over here. They're doing this biology classes at the medical college. And so you feel kind of grown up when you're in high school and you get to go to the medical college to take a course over the summer or to just join a group of people who are interested in biomedical sciences. That gives you like some hope. And it also lets you know that you can do this because I see others that look like me. They don't. All of them don't have to look like me. They don't have to be female. But you can see others that are doing what you want to do, and you know then that you can do it.
Yeah.
Right.
Amazing.
Yes.
So you touched on this a little bit, but I'd like to ask you again to see if you want to expound on your earlier comments. But why do you feel that early mentorship is so important for the young people that your group is targeting?
Well, creating a vision helps because if you can put that vision in the back of your mind, then you know that when the tough thing comes up, you can say, oh, wait a minute, I still have my vision. But being able to give them that experience helps because now that I've got an experience and I might have a small skill set, then I know I can go forward and I can make the next step. And even though I might be on track to do X, Y, Z, at least I know if I change from that, I've done this, I've accomplished this, and I can now do the next thing. Right. So it's important from a young age to be able to take those hopes and dreams and to just sort of fortify them with as much experience as possible to be able to get to that end goal of doing what you want to do that's going to be your passion and it's going to be something that you can excel in.
Definitely. Yeah,
And be
I
successful.
agree. And there's the old adage of if you aim at nothing, you'll achieve it every time.
Right.
But as you referred to earlier, if these young people, especially from underserved communities, underserved populations as far as the medical field is concerned, healthcare is concerned, if they don't visualize this as something that I can do, it's hard for them to set that as a goal and work for it. So
it is.
Giving them that opportunity is just an amazing thing. I'm curious as well. So there are so many medical what's the term I want? Membership associations across the state. And then there's a lot of health-aligned, health-interested alliances and entities across the state. Are any of those larger, whether they're large or small organizations, partnering with you guys to try and help grow this youth medical mentorship program?
I will say yes, because I know that there are great partners out there.
Okay.
I am hesitant to actually name them in case I get them wrong
I wasn't asking
or
for
leave
name
any
names,
off. Right.
But seeing how you guys are trying to grow,
yes,
if you're getting
yes,
support.
There are health systems that support, the colleges support. I believe the Oklahoma State Medical Association helps support as well.
Okay.
So yes, Tulsa County Medical Society, we've supported, yes.
Outstanding.
Throughout.
Outstanding.
Well, Dr. Smallwood, thank you so much for being here.
You're welcome.
I think we're going to end the episode. I had one last question for you. You know, you're involved in immigration care. You're an ER doc, family physician. You're mentor to bright young minds. We talked earlier. You're a mom and a grandmom, and so many roles that you're filling. How do you compartmentalize all of these roles, or do they all just kind of connect? Blend together.
They connect.
They connect.
They actually connect, because I believe my purpose of being here is to take the knowledge and the talents that I've been given and shower that on everyone else.
Wonderful.
And then I just take my love and do the same thing. So being a family physician allowed me to do that, because I had all of the experiences in different areas. And so I was just able to give what I've got.
Amazing.
That's great. Thank you so much for joining us, Dr. Vidal.
You're
great
welcome. Thank
partnering
you.
with you
As always,
again
sir.
to meet another fascinating family doc. And listeners, thank you. Viewers, thank you for joining us. And we'll see you next time on our next episode of Fast Talks with Family Docs.
Thank you for joining us today. The doctors would like to see you back for another check-in. Please choose to follow our podcast, and you will automatically be notified when it's time for your next appointment.